So how on earth do you measure a disease that seems to change absolutely everything? Well, today, we're going to dive into the single most important tool used to track ALS. It's called the ALSFRS-R. It's basically a simple questionnaire, but it has become the global standard for both patient care and the hunt for a cure. So let's break down exactly how it works.
All right, so let's start with the big problem, right? The fundamental challenge here is that ALS isn't a disease that just hits one spot. It can impact your speech, how you swallow, the strength in your hands, your ability to walk, and even your breathing. And often, it's hitting all of these things at once and in totally different ways for different people. You can see how that complexity just makes tracking the disease incredibly difficult.
So to deal with all that complexity, what doctors really needed was a kind of universal yardstick. A tool that works exactly the same way whether you're in a clinic in Ohio, a research center in Germany, or part of a clinical trial in Japan. They needed something that could give them a consistent, reliable snapshot of a person's physical function over time.
And that tool is the ALS Functional Rating Scale revised, or as everyone calls it, the ALSFRS-R. The best way to think of it is as a common language. It lets everyone, doctors, researchers, therapists, measure and talk about exactly how the disease is impacting someone's ability to do all those everyday things we take for granted. Okay, so how does this thing actually work? Let's get into the nitty-gritty and decode this score. We're going to break down the numbers and see what they really mean. And you'll see it's actually pretty straightforward once you get the structure. The whole scale, it all comes down to a total possible score of 48. 48 is the magic number. A score of 48 means completely normal function across every single activity being measured. It's the starting line, the baseline.
But where does that 48 come from?
Well, believe it or not, it's built from just 12 simple questions. That's it. And each one of those questions is like a little window into a different part of daily life. Everything from being able to speak clearly to having the strength to climb a flight of stairs.
And the scoring for each of those 12 questions, it's deceptively simple. It's just a scale from 4 down to 0. 4 means you're doing great, totally normal function. 0 means, unfortunately, you can't perform the task at all. But the real genius, the real power, is in those numbers in between, the 3, 2, and 1. They allow doctors to track the slow, gradual changes with incredible precision.
Now, these 12 questions aren't just picked out of a hat. They're actually super organized into 4 distinct groups, which we call domains, and each domain represents a major area of the body that ALS can affect. So let's take a quick tour through them, shall we? First up, we've got something called bulbar function. Now, that's a bit of a medical term, bulbar, but all it really refers to are the muscles in your head and neck, the ones controlled by the brainstem. So to put it simply, this whole section is about the ability to speak, chew, and swallow. And right here, with speech, you can really see the power of this scale. It's not just a black and white question of, can you speak? Yes or no. It captures all those subtle, in-between stages. A slight disturbance in your speech, then maybe needing to repeat yourself to be understood, or eventually relying on a communication device. Each step down that scale tells a really important story of change.
All right, let's move on to the second domain, fine motor function. As the name suggests, this part focuses on the hands and arms. It's evaluating all those tasks that need dexterity and coordination, things that, for many people with what's called limb-onset ALS, are often some of the very first things to be affected.
I mean, just think about handwriting. It seems like such a simple thing, right? But the scale uses it to track really profound changes in dexterity. You can see the whole journey right here in this scoring. From your handwriting just getting a little sloppy, to some words becoming illegible, all the way to not being able to form words at all, and then, finally, not even being able to grip the pen. It's all there.
Okay, domain number 3 is gross motor function. So we're shifting gears here. We're moving away from the fine, delicate movements of the hands to the big, powerful movements of the legs and the torso. This is all about mobility, walking, turning over in bed, just generally getting around. And the question about walking, it's just a perfect example of how the scale tracks a person's independence. It captures that entire journey, from walking normally to maybe having some early difficulty, to needing assistance like a walker, and then eventually becoming non-ambulatory. Every single step down on this scale represents a huge change in someone's mobility and their life.
And that brings us to our fourth and final domain. And honestly, this one is critically important. It's respiratory function. This section is all about measuring the strength of the breathing muscles and figuring out if and when someone might need breathing support. And check out how the scale measures dyspnea. That's the medical term for shortness of breath. It's so clever. It doesn't just ask, are you short of breath? Yes or no. It links that feeling to specific everyday actions. Like, does it only happen when you're walking? Or does it happen when you're doing something as simple as getting dressed? That little detail gives doctors a much more accurate picture of how someone's breathing is changing.
So, okay, we've got these scores for all 12 questions. We add them up, but what does that number actually mean? How is it used to understand the disease? This is where we zoom out from a single number to the bigger picture.
Now, if you take away only one thing from this, let it be this. It is not about a single score. A score from one doctor's visit is just a snapshot in time. The real power, the real insight comes when you connect those dots over months or even years. It's the slope of that line, the rate of decline that tells doctors and researchers everything about how fast the disease is progressing.
And that is why this scale is the absolute backbone of pretty much every single ALS clinical trial. It's how we measure success. Researchers will have a placebo group, and they'll have a group getting a new experimental drug. And they use the ALSFRS-R to ask one simple, crucial question. Is the rate of decline slower in the group getting the treatment? If the answer is yes, well, that's a huge sign that the therapy might actually be working.
All right, let's zoom out one last time and put all of this into context. Because look, the ALS-FRS-R is a really powerful tool, for sure, but it's not the only tool. And to get the full picture, you really have to understand both its strengths and its weaknesses.
So, on the one hand, the advantages are obvious, right? It's simple to use, it's standardized everywhere, and it measures things that actually matter in the real world. But it does have limitations. It's based on what a person reports, it's subjective, and more importantly, it measures function, not the underlying biology. So it's possible for someone's score to stay the same, even while subtle changes are happening at a cellular level. And because of those limitations, what you're seeing now is researchers combining the ALS-FRS-R with a whole new toolkit of emerging tech. They're looking at things like biomarkers in the blood. You may have heard of neurofilament levels. They're using super precise respiratory tests and even digital monitoring to get a more objective day-to-day picture. All these things add another layer of deeper, more objective data.
But here's the thing. Even with all these new fancy technologies, the ALS-FRS-R is still absolutely essential. And you might ask, why? It's because it measures what, at the end of the day, matters most to people living with the disease, their daily function. It goes beyond the biology and answers that fundamental human question. How is this affecting my life right now? And when you think about it, that might just be the most important thing to measure of all.